Sir.
Congressman, good morning. I work for a pharmaceutical company. I'm in human resources for one of the firms here in the North Shore. And to the first issue that I believe this country is facing is jobs. The healthcare issue is certainly critical and front and center, but the mess this economy is in right now is really crippling our ability on a number of different fronts to be able to provide the adequate services our citizens need. Now, in terms of healthcare, what concerns me is that you seem to have this market will solve the problem approach. Let the market solve it. Let's let market forces dictate what the costs will be. Let's get a national plan where you can buy insurance in Arizona or if you live in Illinois. The market is what has gotten us into this problem. We have gone through managed care. I've gone through HMOs. I've gone through the PCP, your primary care physician, all in attempts to hold back my insurance costs, my benefit costs, the company I work. None has worked. We are now seeing the escalation of these insurance premiums to the point where in 10 years, if we don't address it now, there won't be anything like what we have right now completed in terms of its completion of coverage. If the market is the answer, then why did we have to give 13% premium to healthcare companies in Medicare Advantage to cover the Medicare folks? And the reason is because Medicare costs wouldn't allow them to get the profits they need. So the former administration gave them a 13% premium. Now, it can't be the market. The market is part of the problem. And a public option will offer an alternative to these kinds of issues that the market is unable to address.
If we launch the kind of borrowing that I showed you that will happen under this bill, in the teeth of the Great Recession, one of the largest tax increases in history, and then we borrow the money at the rate we're borrowing. By the way, anybody know how much we're borrowing per week?
We pay for wars.
It's $160 billion per week we're currently borrowing. And we've been told by our foreign creditors that they don't want to buy any more Treasury paper. We are running out of other people's money. And so can we do any good if we make a promise that we cannot afford to keep?
Congressman
Your
Kirk.
first point was the best one. The best social program is a job and a growing economy.
Hello, Congressman. Very short question. First of all, what is your opinion about legislation HR 3200?
I'm against it.
Okay, and next, you mentioned the sample from Canadian people who visiting US. Yesterday I heard this reportage from on the Fox, and what is shocked me, those gentlemen who pay cash for surgery about brain tumor and MRI paid 1/4 of a price which US insurance company would pay to the same hospital, to the same doctor. And I want to hear a comment about it, because here I guess it's huge saving overall what we are talking about. Thank you.
Right. I just say, I just say that most of the Canadian patients, when they're denied by Canada Health, the day they come pay it, they pay full price on their Visa card. One of the reasons why the Mayo Clinic is so popular is because so many middle-class Canadians who are denied care then come across the border to get care right there. My worry is that if we put that kind of delay and controls on our care, where do we drive? Sir.
Congressman, I'd like to thank you for doing 15 of these. I'm from Oak Park. No opportunity to attend these in Oak Park. I made a suggestion last time. I want to see if Congressman Kirk have people working on it, that like the military does, they pay the bills for people to go to medical schools and to nursing schools. And they serve for 4 or 5 years. I'm proposing that so we take care of the emergency room problem where we have to give people medical care. Have free medical clinics by anybody who can qualify to go to medical school or nursing school open up those schools, pay their bills by them serving for 5 years, like 1 day a week, at no compensation, and that loan would be exempt from the bankruptcy laws.
I will say that under Medicare, we do provide a substantial amount for graduate medical education. Because Medicare is such a dominant force now, there's a worry about pediatric training. So there's part of the Medicare program that actually pays for pediatrics, so we don't run out of pediatricians. But your point is well taken. Well, we've just gone through the 15th town hall meeting. Thank you all for being here.